Depression is much more than fleeting sadness or a temporary case of the blues. Scientifically, it is recognized as a complex mental health disorder that can profoundly alter how a person feels, thinks, and navigates the world. According to the National Institute of Mental Health, major depressive disorder is marked by persistent feelings of sadness or loss of interest that last for at least 2 weeks and represent a clear change from previous functioning. These symptoms are not just emotional, they affect both body and mind, influencing sleep, appetite, energy levels, concentration, and even the ability to experience pleasure. For some, depression becomes so severe that it interferes with daily tasks, relationships, and the most basic aspects of self-care. The prevalence of depression is striking. Globally, the World Health Organization reports that depression affects more than 280 million people. In the United States alone, recent data from the National Institute of Mental Health shows that approximately 21 million adults, about 8.3% of all United States adults, experienced at least one major depressive episode in 2021. The numbers are even more concerning among adolescents and young adults, with surveys from the Centers for Disease Control and Prevention indicating that rates have risen in recent years, disproportionately affecting females and those with lower incomes. Depression is not limited by geography, age, or social status, but certain groups are at higher risk. Women are diagnosed with depression at nearly twice the rate of men worldwide, and the condition often emerges during late adolescence or early adulthood, as supported by both national and international health agencies. The impact of depression reaches far beyond the individual. It is a leading cause of disability worldwide, according to analyses in Nature and the World Health Organization, and contributes substantially to the global burden of disease. Depression can disrupt work, school, and family life. It is closely linked with other physical and mental health conditions and, in its most severe forms, can lead to suicide, a tragic outcome that remains one of the leading causes of death among young people, as noted by organizations like the National Alliance on Mental Illness. Understanding what causes depression is not straightforward. Research has shown that depression arises from a complex interplay of biological, psychological, and social factors. Biologically, scientists have identified various changes in brain structure and function among those with depressive disorders. Imbalances in neurotransmitters, the chemicals that help transmit signals in the brain, have been implicated, as have disturbances in sleep and inflammatory processes. Genetics play a role as well. Having a close family member with depression increases risk, but it does not guarantee that someone will develop the illness. Psychological factors are equally important. Individuals with certain personality traits, such as low self-esteem or a tendency toward pessimism, may be more vulnerable. Chronic stress, traumatic events, and ongoing adversity can trigger or worsen depressive symptoms, especially for those already at risk due to their biology or life circumstances. The way a person thinks and copes with stress can influence how depression develops and persists. Cognitive patterns marked by hopelessness, excessive self-criticism, or rumination often accompany depressive episodes. The social environment also plays a significant role. According to the biopsychosocial model, the interaction between a person's biology, psychology, and social context shapes their mental health. Isolation, lack of support, financial hardship, or exposure to discrimination can all contribute to depression. Conversely, strong social connections and supportive relationships can offer some protection, although they are not always enough to prevent the disorder. Diagnosing depression requires careful evaluation. The Diagnostic and Statistical Manual of Mental Disorders, 5th edition, DSM-5, outlines specific criteria for a major depressive episode. A person must experience at least 5 symptoms, such as depressed mood, loss of interest, changes in appetite or weight, sleep disturbances, fatigue, feelings of worthlessness or guilt, difficulty concentrating, and recurring thoughts of death or suicide, for most of the day, nearly every day over a 2-week period. At least one of these symptoms must be either a depressed mood or a marked loss of interest or pleasure. It is important to rule out other possible causes, such as medical conditions or substance use, before making a diagnosis. The experience of depression is not the same for everyone. Symptoms can vary in intensity and duration, and not everyone will exhibit the same set of signs. Some people may function relatively well despite feeling persistently low, while others become unable to meet even basic daily demands. Depression can also co-occur with anxiety disorders, substance use, or chronic illnesses, which complicates treatment and recovery. Despite how common depression is, many individuals do not seek help. Stigma remains a significant barrier, as highlighted in reviews from StatPearls and other sources. Misunderstandings about the nature of depression, viewing it as a personal weakness rather than a legitimate health condition, can prevent people from reaching out for support or treatment. This is particularly concerning given that effective treatments are available and early intervention can make a meaningful difference. Treatment approaches for depression are informed by our growing understanding of its multifactorial origins. Medications, particularly those that target neurotransmitter systems, have been shown to help many people. Psychotherapy, including cognitive behavioral therapy and interpersonal therapy, offers strategies for managing symptoms and addressing underlying thought patterns. Yet, not all individuals respond to these interventions in the same way. Researchers have observed that a significant proportion of those with depression do not achieve full remission with initial treatments, which has led to an ongoing search for new and complementary therapies. It is also increasingly recognized that lifestyle factors can play an important role in both the onset and management of depression. Regular physical activity, adequate sleep, and a balanced diet have all been associated with improved mood and reduced symptoms for many. However, the effectiveness of these strategies can vary widely based on individual circumstances and the severity of the disorder. In summary, depression is a complex, multifactorial condition that affects millions around the world. Its symptoms range from emotional distress to physical changes, disrupting lives and communities alike. Science continues to unravel the intricate web of biological, psychological, and social influences that give rise to depression, and this knowledge forms the bedrock of current diagnostic and treatment models. While much has been learned, gaps remain, especially in understanding why some individuals are more resilient or why certain treatments work better for some than others. What is clear is that depression is a real and serious health concern, deserving of compassion, scientific rigor, and a commitment to ongoing discovery. When someone is diagnosed with depression, the first question that often arises is, what can be done to help? For decades, clinical treatment has relied on two primary approaches: medications, specifically antidepressants, and structured psychotherapy. These traditional treatments have been extensively researched, carefully scrutinized, and continually refined, as scientists and clinicians strive to understand not only how well they work, but also for whom they are most effective and at what cost. Antidepressants have been a cornerstone in the treatment of depression since the mid-20th century. Their main function is to alter the balance of neurotransmitters, chemical messengers like serotonin, norepinephrine, and dopamine in the brain. While the precise mechanisms by which these drugs alleviate depressive symptoms remain only partially understood, clinical trials consistently show that many antidepressants are more effective than placebo in reducing symptoms. Large-scale analyses, such as those reported in The Lancet, reveal that most widely used antidepressant medications outperform placebo, though the degree of benefit varies from person to person and across different drug types. Yet, the story is not as simple as medication equals relief. The effectiveness of antidepressants is significant for some individuals, but far from universal. Systematic reviews highlight that only a certain percentage of those treated with these medications achieve a full response, and the rates of remission, meaning the complete absence of clinically significant symptoms, are even lower. This is especially pronounced in cases of late-life depression or when individuals have experienced multiple prior episodes. For some, antidepressants provide a lifeline, lifting the pervasive weight of low mood and restoring a sense of normalcy. For others, the benefits are modest or remain elusive. The limitations of antidepressants go beyond uneven effectiveness. Side effects are a common and sometimes significant barrier. Patients frequently report issues ranging from gastrointestinal disturbances, sleep disruption, and sexual dysfunction to more serious concerns such as weight gain and cardiovascular effects. These side effects are not mere nuisances. In many cases, their persistence or severity leads individuals to discontinue medication prematurely, reducing the chances of sustained improvement. Research underscores that the physiological effects of antidepressants can impact cardiometabolic health, and there is wide variability in both side effect profiles and how tolerable they are for each person. The challenge becomes more acute when considering treatment-resistant depression, a condition where individuals fail to respond adequately to at least two different antidepressant regimens at appropriate doses and durations. Estimates from clinical studies suggest that a significant fraction of people with depression fall into this category, facing persistent symptoms despite standard pharmacological care. For these individuals, the ongoing search for more effective interventions is not merely academic, it is deeply personal, often marked by frustration, disappointment, and a pressing need for alternative or adjunctive strategies. While medications play a prominent role, psychotherapy has long stood as an equally important pillar of depression treatment. Among the various forms of therapy, Cognitive behavioral therapy, also known as CBT, and interpersonal psychotherapy, also known as IPT, are two of the most rigorously studied. Cognitive behavioral therapy focuses on identifying and reshaping negative patterns of thought and behavior, while interpersonal psychotherapy addresses issues surrounding relationships and social functioning. Decades of randomized controlled trials and meta-analyses have shown that both cognitive behavioral therapy and interpersonal psychotherapy are effective in alleviating depressive symptoms, with average outcomes that are broadly comparable. Some studies suggest subtle differences in the types of patients who benefit most from each approach, but overall, both therapies are evidence-based choices for clinicians and patients alike. The effects of psychotherapy are not short-lived. Systematic reviews highlight that the benefits of structured psychotherapies often endure well beyond the end of the intervention, sometimes outlasting the gains seen with medication alone. This durability is particularly evident when therapy is delivered with sufficient intensity and duration, though even brief forms of cognitive behavioral therapy or interpersonal therapy can produce meaningful improvements. The acceptability of psychotherapy is generally high, with fewer physical side effects compared to pharmacological treatments, though therapy is not without challenges. Commitment, time, and access can all present barriers. A growing body of evidence also supports the combined use of medications and psychotherapy. When used together, these approaches can produce greater and more sustained improvements than either modality alone, especially in cases where depression is severe or has not responded to a single intervention. Combination treatment is often recommended for individuals with chronic or recurrent depression, as well as those who have not achieved satisfactory relief from initial therapy or medication trials. Despite these advances, it is clear that neither medication nor psychotherapy is a panacea. The reality of treatment-resistant depression remains, prompting ongoing research into new therapeutic strategies. In recent years, attention has turned to the role of complementary and alternative medicine, or CAM, in managing depression. Some interventions, such as St. John's wort, omega-3 fatty acids, and acupuncture, have been studied, but the evidence for their effectiveness is mixed and often less robust than for established treatments. Among the many non-pharmacological options, exercise consistently emerges as a promising adjunct to traditional care. Meta-analyses indicate that adding regular physical activity to standard treatment protocols can result in greater reductions in depressive symptoms than standard care alone. The physiological and psychological mechanisms by which exercise exerts its antidepressant effects are still under investigation, but the data suggest benefits that are both substantial and meaningful for many individuals. In fact, the comparative efficacy of exercise and other non-pharmacological treatments has been found to be similar to that of antidepressants as first-step interventions, according to recent meta-analyses. This finding underscores the importance of considering lifestyle interventions as part of a comprehensive, individualized approach to depression care. Ultimately, the journey through depression treatment is rarely straightforward. The established therapies, medications, and psychotherapy offer hope and relief for many, but not all. Their limitations, whether in the form of side effects, incomplete response, or accessibility challenges, highlight the continuing need for innovation and flexibility in care. As our understanding of depression deepens, so too does the appreciation for an integrative model, one that recognizes the value of combining traditional treatments with emerging and complementary strategies, always with the goal of alleviating suffering and restoring a sense of well-being for those affected. Science, compassion, and a willingness to adapt remain the guiding lights on this complex and evolving path. In recent years, the idea that exercise can serve as a powerful form of medicine for depression has moved from the fringes of mental health discourse to the center of scientific conversation. No longer limited to self-help advice or wellness trends, the evidence supporting exercise as a treatment for depression is now robust, detailed, and grounded in rigorous systematic reviews and meta-analyses. This expanding body of research is reshaping clinical guidelines worldwide, placing physical activity alongside traditional interventions such as medication and psychotherapy. But what is it about moving the body, whether through a brisk walk, a yoga session, or lifting weights, that can change the mind? The answer lies in a fascinating interplay of biology, chemistry, and psychology. Multiple large-scale analyses, including those published in respected journals like the British Medical Journal and synthesized in umbrella reviews, have shown that exercise is not merely beneficial for people experiencing depression. It is often as effective as established treatments. In direct comparisons, supervised exercise programs, particularly those involving walking, jogging, yoga, and strength training, have produced reductions in depressive symptoms on par with psychological therapy and antidepressant medication. Meta-analyses have found that the effects of exercise interventions, especially when conducted in a group setting or under supervision, can be large and clinically significant. This consistent pattern across diverse studies suggests that the therapeutic power of exercise is not a statistical fluke or limited to specific subgroups, but a generalizable phenomenon. Naturally, this raises the question, how does exercise achieve these effects? The answer begins at the molecular and cellular level within the brain. When a person engages in physical activity, whether moderate or vigorous, a cascade of neurobiological changes is set in motion. Chief among these is the release of endorphins, natural chemicals that act as the brain's own painkillers and mood elevators. This endorphin surge is often credited with producing the so-called runner's high, but its relevance extends well beyond fleeting feelings of euphoria. Endorphins interact with systems in the brain that regulate mood, reward, and motivation, helping to counteract some of the neurochemical imbalances commonly observed in depression. But the story does not end with endorphins. Exercise also stimulates the production of brain-derived neurotrophic factor, or BDNF, a protein crucial for promoting neuroplasticity, the brain's ability to reorganize itself by forming new connections between neurons. Depression is frequently associated with reductions in BDNF and structural changes in key brain regions, such as the hippocampus, which is involved in memory and emotional regulation. By increasing BDNF levels and encouraging the growth of new neural pathways, exercise may help reverse some of the neurobiological footprints of depression. This idea is supported by a growing literature on hippocampal neurogenesis, which suggests that regular physical activity can lead to measurable structural changes in the brain. Beyond these direct effects on brain chemistry and structure, exercise also influences the body's stress response systems. Chronic stress is a well-established risk factor for depression, exerting much of its harmful influence through the hypothalamic pituitary adrenal axis, a hormonal system that governs the release of cortisol and other stress hormones. In people with depression, the hypothalamic pituitary adrenal axis is often dysregulated, leading to elevated and prolonged stress responses. Exercise appears to help recalibrate this system, reducing baseline levels of stress hormones and enhancing the body's ability to cope with psychological challenges. This improved stress resilience may help explain why people who maintain regular physical activity report fewer depressive symptoms and greater emotional balance. The immune system also plays a role in the relationship between exercise and depression. Research increasingly points to inflammation as a contributing factor in the development and persistence of depressive symptoms. Regular physical activity has been shown to modulate the immune response, lowering levels of pro-inflammatory markers and promoting an anti-inflammatory environment in the body. This immune modulation creates conditions less conducive to the onset and maintenance of depression, offering yet another biological pathway through which exercise exerts its antidepressant effects. While these physiological mechanisms are compelling, the psychological and behavioral dimensions of exercise are equally important. Engaging in regular physical activity often provides a sense of mastery and accomplishment, countering the helplessness and loss of motivation that are hallmarks of depression. Group-based exercise introduces an element of social connection, which itself is a protective factor against mood disorders. Even solo activities like walking or jogging can disrupt cycles of rumination, providing a mental break and a sense of forward motion, both literally and figuratively. The question of what type and dose of exercise is most effective for treating depression has been explored in several systematic reviews and meta-analyses. Evidence indicates that both aerobic activities like walking or jogging and resistance training such as weightlifting yield significant benefits. Yoga, as a mind-body practice, has also shown promising results, particularly in reducing depressive symptoms and improving stress resilience. Moderate-intensity exercise performed regularly, typically at least 3 times per week, appears to strike the optimal balance between efficacy and sustainability for most individuals. High-intensity exercise can be beneficial as well, but may not be suitable or appealing for everyone, especially those experiencing severe symptoms or physical limitations. Notably, patient preferences matter. Surveys indicate that many people with depression find exercise to be an acceptable and even preferred treatment, especially when it is tailored to individual interests and abilities. Importantly, leading health organizations such as the World Health Organization and the National Institute for Health and Care Excellence have begun to recommend exercise as an adjunct treatment for depression, a recognition grounded in the cumulative weight of scientific evidence. These recommendations emphasize the need for individualized protocols, recognizing that the best exercise regimen is one a person can maintain over the long term and that fits their unique circumstances. Despite the compelling case for exercise as medicine, researchers acknowledge that there are still unanswered questions. While the general mechanisms are well described, the precise ways in which exercise interacts with other treatments, such as medication and psychotherapy, are not yet fully understood. There is also variation in response, with some individuals experiencing dramatic improvements and others only modest benefits. As with all treatments for depression, a one-size-fits-all approach is unlikely to be successful. Nevertheless, the scientific consensus is clear. For many, physical activity offers a potent, accessible, and low-risk avenue for alleviating the symptoms of depression and supporting long-term mental health. The challenge now lies in translating this knowledge into everyday clinical practice and empowering individuals to harness the restorative power of movement as part of a holistic approach to mental wellness. For many people living with depression, the thought of adding exercise to an already overwhelming to-do list can feel impossible. Yet the evidence supporting physical activity as a cornerstone of depression care is now so compelling that leading experts and guidelines recommend its integration, not as a supplemental afterthought, but as a genuine first-line treatment, provided it is tailored to the individual. For both clinicians and patients, the challenge is not in recognizing the benefits, but in turning that science into real-world action. How does someone begin, and more importantly, maintain an exercise routine when motivation and energy are often in short supply? A crucial first step is understanding that there is no single right way to exercise for depression. The most effective approaches consider a person's unique preferences, physical abilities, and life circumstances. Recommendations have shifted decisively toward personalized, individual-based exercise prescriptions, as demonstrated in recent randomized controlled trials. These studies consistently show that both aerobic and resistance training can significantly reduce depressive symptoms, but matching the type and intensity of exercise to the individual's baseline fitness, interests, and barriers is essential for optimal results. In fact, tailoring exercise interventions, whether through detailed assessments, collaborative goal setting, or even advanced methods like machine learning guidance, has been shown to improve both adherence and mood outcomes in people with depression. For most adults, moderate intensity exercise stands out as the sweet spot. Research suggests that activities performed at this level, where breathing increases but conversation is still possible, are linked to greater enjoyment and better adherence over time. Enjoyment may seem like a luxury in the context of depression, but it is a critical factor. People who find pleasure in their chosen activity, whether it is brisk walking, cycling, yoga, or swimming, are far more likely to stick with it. On the other hand, high-intensity regimens, while beneficial for some, can discourage those already struggling with fatigue, low self-worth, or physical limitations. Despite growing enthusiasm for exercise-based treatment, many barriers stand in the way of making it a routine part of care. Some obstacles are internal, low mood, lack of motivation, or the core symptoms of depression can drain the will to move. Others are practical, limited time, resources, or access to safe spaces for physical activity. Healthcare providers also face challenges such as uncertainty about how to prescribe exercise, lack of training in motivational techniques, or constraints within clinical settings. Overcoming these barriers requires both creativity and compassion. One evidence-based strategy is motivational interviewing, a collaborative, person-centered counseling style that helps individuals resolve ambivalence and strengthen their own motivation for change. When combined with structured goal setting, this approach can help people identify meaningful, achievable steps toward greater activity. For example, instead of setting a vague goal to exercise more, a person might work with a clinician to create a specific plan. I will walk around the block for 10 minutes after lunch on Mondays, Wednesdays, and Fridays. The clarity and specificity of such goals, along with regular opportunities to revisit and adjust them, are key drivers of adherence. Self-monitoring is another powerful tool. Keeping a simple record, on paper, a smartphone, or a wearable device, makes progress visible and provides a sense of accomplishment, even when changes are small. Research shows that this sense of mastery, however modest, can interrupt cycles of hopelessness common in depression. It also offers tangible evidence that effort is paying off, which can help counteract the distorted thinking patterns that often accompany the illness. Social support plays a particularly important role in maintaining an exercise routine. Studies indicate that people with depression are more likely to continue physical activity when they involve others, whether a friend, family member, or organized group. Having a supportive companion not only makes the activity more enjoyable, but also provides accountability and a buffer against the isolation that often comes with depression. For some, simply agreeing to meet someone for a walk or class can provide the extra push needed to get out the door when motivation is low. Enjoyment, support, and structure are important, but so is flexibility. Depression is not a static condition. Symptoms can wax and wane, sometimes unpredictably. Plans that are too rigid can lead to feelings of failure if they are not met, which can reinforce avoidance. Instead, experts recommend a compassionate, adaptable approach. If a planned session feels impossible on a tough day, a shorter or gentler activity can still count as a success. The goal is progress, not perfection. Healthcare providers are encouraged to view exercise not as a one-size-fits-all prescription, but as a lifelong habit to be cultivated and adjusted over time. Evidence-based policy recommendations now suggest that clinicians adopt a holistic, integrative mindset, considering exercise alongside other lifestyle strategies such as nutrition, sleep, and stress management. The aim is not just short-term symptom relief, but lasting well-being. Some of the most promising results have come from programs that combine exercise with psychological interventions. Meta-analyses indicate that pairing physical activity with behavioral therapy can lead to greater and more sustained reductions in depressive symptoms than either approach alone. This might take the form of structured group programs, individualized coaching, or technology-assisted interventions that use machine learning to optimize plans based on ongoing feedback. For those just starting out, the key is to begin small and build gradually. Even brief bouts of activity, 5 or 10 minutes at a time, can yield measurable benefits and help lay the groundwork for more regular movement. Setting realistic, personally meaningful goals, tracking progress, seeking support, and allowing for flexibility are all research-backed strategies shown to work in the context of depression. Despite the challenges, the message from the scientific community is clear. Exercise, when thoughtfully integrated and tailored to the individual, can be a powerful tool in the treatment of depression. It is not a cure-all, nor does it work equally well for everyone, but it offers a pathway toward improved mood, greater resilience, and a renewed sense of agency. By understanding both the obstacles and the facilitators, and by drawing on evidence-based strategies, individuals and providers can work together to make exercise a sustainable part of lifelong depression care. As the field of depression treatment evolves, researchers and clinicians are increasingly moving beyond single interventions toward broader, more holistic strategies. The story of exercise as a treatment for depression exemplifies this shift. While the scientific community now recognizes that physical activity can meaningfully reduce depressive symptoms, there is growing consensus that its greatest value emerges when it is part of a comprehensive, personalized care plan. Overcoming the persistent gaps in depression treatment, those areas where traditional approaches fall short, requires a fresh, integrated perspective that considers not just the mind or body in isolation, but the whole person. One of the most promising directions in current research involves integrating exercise with a range of non-pharmacological interventions. Rather than presenting physical activity as a standalone cure, studies increasingly examine its role within a multimodal treatment landscape. This is especially relevant for populations in whom depression can be particularly challenging to manage, such as older adults. Reviews of late-life depression highlight the potential of combining exercise with psychotherapy, lifestyle modifications, and even digital technologies. These approaches aim to address multiple aspects of well-being simultaneously, from mood and cognition to social connection and physical health. By layering these supports, the goal is to achieve more resilient, longer-lasting improvements in quality of life. The rationale behind such holistic models draws from a growing body of evidence on the interplay between lifestyle factors and mental health. For example, community-based approaches that emphasize physical activity, nutrition, social engagement, and stress management are gaining momentum as both preventive and therapeutic measures. These strategies are not just about reducing symptoms, they are about building the foundations for sustained recovery and emotional resilience. The move toward lifestyle medicine reflects a recognition that depression is rarely caused by a single factor and that lasting healing often requires attention to multiple areas of life. Personalization is another frontier reshaping the conversation. No two experiences of depression are identical, and the same is true for responses to exercise-based interventions. Researchers are now exploring ways to tailor exercise prescriptions with greater precision. This can involve matching activities and intensities to individual preferences and physical abilities, but it may also mean leveraging new technologies. Machine learning and artificial intelligence are being piloted as tools to guide individualized treatment plans. Early studies suggest that these systems, by analyzing patterns in behavior and mood, may be able to recommend exercise routines that adapt in real time to a person's changing needs and circumstances. The vision is not a universal protocol, but a dynamic partnership between technology, clinician, and patient, each informing the other to optimize outcomes. Of course, exercise is only one part of the puzzle. The future of depression treatment increasingly points toward integrated care, where physical activity is combined with other evidence-based modalities. Psychotherapy and pharmacological treatments are not being replaced, but rather complemented. Reviews highlight the potential of combined approaches, not just for symptom relief, but for fostering motivation, enhancing self-efficacy, and supporting long-term adherence. In practice, this might look like a program blending exercise sessions with group therapy, nutritional counseling, and regular check-ins via digital platforms. The aim is to provide ongoing, coordinated support that addresses the complexity of depression in real-world settings. A holistic approach also means considering the broader context in which depression arises and persists. Social determinants of health, such as isolation, economic stress, and access to resources, play a significant role in both the onset and course of depression. Community-based programs that promote physical activity, encourage social interaction, and build supportive environments are increasingly recognized as powerful adjuncts to clinical care. These initiatives often extend beyond medical offices, reaching into neighborhoods, workplaces, and schools to make healthy behaviors more accessible and sustainable. Nutrition and other mind-body practices are also being woven into comprehensive care plans. While exercise can improve mood and cognitive function, dietary interventions may support brain health, and practices such as meditation or yoga can help regulate stress and emotion. The guiding principle is not to favor one modality over another, but to draw on multiple, complementary strategies, each reinforcing the others to create a network of support. Prevention is another dimension, receiving renewed attention. Many experts argue that the future of depression care lies as much in preventing illness as in treating it. Lifestyle interventions, including exercise, are being studied not only for their ability to alleviate symptoms but also to reduce risk in vulnerable populations. Public health initiatives that encourage regular physical activity across the lifespan may offer protective benefits, potentially narrowing the treatment gap for those who might otherwise never seek or receive care. Despite these advances, significant challenges remain. Access to holistic, integrated care is uneven, often limited by systemic barriers such as cost, availability of trained professionals, and social stigma. Digital technologies, while promising, face obstacles related to engagement, privacy, and equity. And while personalization holds great potential, the science of what works for whom is still in its early stages. Ongoing research is needed to clarify how best to combine and sequence interventions, and to identify which individuals are most likely to benefit from specific combinations of exercise, psychotherapy, medication, and lifestyle supports. The evolution toward holistic, personalized depression care is not simply about adding more interventions, it is about reimagining the entire therapeutic process. At its heart is the recognition that healing is a journey, one that unfolds in partnership with individuals, families, and communities. Ongoing support, flexibility, and compassion are essential, as is the willingness to adapt strategies as new evidence emerges. In summary, the future of exercise as a treatment for depression lies in its integration within a broader, holistic framework. This approach values prevention and early intervention, embraces multimodal and community-based strategies, and seeks to personalize care using both traditional wisdom and emerging technology. While there is no single path to recovery, the convergence of science, innovation, and holistic thinking offers hope for more effective, sustainable, and humane approaches to one of the most challenging health issues of our time.